A cataract is a cloudiness to the lens on the inside of the eye. When the lens on the inside of the eye is clear, we call it a lens. When it gets cloudy, we call it a cataract. Everyone who lives long enough will get a cataract. With cataracts, patients most commonly notice increased glare and halos around street lights, traffic lights, stoplights. They'll see the glare and halos as if it's a starburst coming off of a light source. Other things they may notice is increased difficulty reading street signs off in the distance, or increased difficulty reading the ticker on their TV at home. Colors may seem a little bit washed out or faded or yellowed because of the cataract. There are different kinds of cataracts. The first kind is what we call a nuclear cataract, or a cataract that just develops with advancing age. There's also a traumatic cataract, diabetic cataract. Some medications cause cataracts. There are cataracts you're born with. Some of them are hereditary. So there's a variety of causes, which ultimately leads up to surgery to fix that. The way that we perform the surgery, we make small incisions in the front of the eye and we remove the old cataract lens using a vacuuming mechanism, and we replace it with a clear plastic lens that lasts forever. That clear plastic lens can be placed in the eye with different kinds of powers, and thanks to technology we have now, there are alternatives to the different kinds of powers we can place in the eye. Cataract surgery has never been safer. There are risks to the surgery, but the benefits are improved vision off in the distance and potentially even up close, depending on the type of refractive result desired by the patient. Once removed, cataract does not regrow. It can't come back. The one thing patients will complain about following a cataract surgery is in roughly 25% of them, they'll get scarring down of the capsule, which is the scaffolding or support system to the lens on the inside of the eye. And if that occurs, we just laser polish it off with a simple 5-minute procedure in the office. It's not even close to the major surgery that cataract surgery is, but still a simple way to reobtain that vision that was provided after cataract surgery. The post-operative course typically is I see my patients 1 day, 1 week, and 1 month after cataract surgery. The patients are on eye drops for 3 days before the surgery to prepare the eye, limit the amount of inflammation, potentially attempt to control the infection risk. Following the surgery itself, they're on eye drops for anywhere from a month to 6 weeks, depending on their level of inflammation. As far as visual recovery, most patients are pretty close to recovered within a week of the surgery. I've had a lot of patients be able to see close to 20/20, 20/25, 20/30 the next day following cataract surgery. So they're doing quite well, depending on the length of the cataract surgery and the advancement of the cataract during the surgery. Sometimes the vision will be a little bit blurry the day after surgery, even a couple of days after surgery, but usually by that 1 week mark, things have pretty well cleared up and they're seeing better.